Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. The Medicare open enrollment period for 2026 is already underway. It started October 15th and runs through December 7th. This is the third year West Virginia-based insurer Peak Health is offering Peak Advantage, a Medicare Advantage plan for eligible West Virginians. In 2026, Peak Advantage is increasing its service and eligibility area into more counties in West Virginia, expanding into Pennsylvania, and adding a new wellness program to its benefit plan. So today, we're talking about the benefits of Peak Advantage with Missy Bazzo, Director of Medicare for Peak Health. Welcome, Missy, to Live Healthy West Virginia.
Thank you, Mary. Very excited to be here.
It's good to have you here again. Well, we've said this before. Peak Advantage is truly a game changer. It's been a successful couple of years so far.
Fastest growing.
Fastest growing. That's fastest growing in the state, correct?
Correct.
Which is very exciting. Do you think it's so popular and such a game changer because it's basically a health plan run by the health system you trust with the support of the same doctors you know who are already treating you?
Yeah, and that's another thing too. We are the only health plan here that was created by the doctors trusted here in the state. And so we're very proud to say that as well, in addition to fastest growing. So we really want to slash that red tape and just ensure that our members are getting the care that they need, and the conversation is taking place between the doctor and the member. And it's that there's no waiting game. It's just that we are here to help them to make sure that they're living their healthiest life with our plan if they join onto our Peak Advantage plan.
Close to home.
Yes, close to home.
Yeah.
Yes.
What are the most noticeable changes? Because this is the third year, going to be the third year.
Yes.
I can't believe that already. What are the most notable changes in the Peak Advantage plan starting in 2026?
So the one main change is our expansion, which you had mentioned prior. So we are in 29 counties now. We're going to be expanding into 22, 20 of them taking place here in this state, 2 in the Pennsylvania market in Fayette and Greene counties, so just right across the border.
Yeah.
So we're just really excited about that, so we can help out as many people as we can. We're just almost there with the full state, so we're just 6 counties shy of that. So hopefully that will be coming soon as well. But in addition to that, the Aging Well program is one program that we did add to the benefit package. So this is a program that's interactive, both in person, online, can help out with wellness, can help out with safety and scams, and just really just getting those experts involved to really help our members just to keep safe and healthy all at the same time.
So when you say it's interactive, is this something that you're notified on your phone, or you can reach out to when you need it, or is it a little bit of both?
So there's a calendar, and so we will notify our clients once these classes are taking place, and we're partnering with WVU with this. So we're very excited about this, and this is something that's exclusive as well. So this is something that no other plan is going to be offering, and this is something that we wanted to add just to really add that value to help towards that everyday healthcare, but also for the everyday safety items as well. So
what kind of classes?
So it could be yoga classes, it's exercise classes, it could be different programs, like we're going to have the FBI involved to help out with like scams. So there's a whole slew of different things. But in addition, we'll help them out on the education side too. So we'll be involved in just kind of doing little snippets around their benefits with the plan as well, just to make sure that they are known and they have the resources that they need to really know the backbone of what their plan is.
Well, that sounds exciting. It really does. Now, Peak Advantage was launched 3 years ago.
Yes.
There's been some other updates made to this year's plan. What are the benefits of the Peak Advantage Vista PPO? I think, is that your most popular?
So Vista and Summit are basically the most popular, I have to be honest. So it's kind of like a 50-50 split. But the great news is that we did not make a change with the premium. So the Vista is still $0,
Awesome.
and the Summit is still $16. So we're very excited about that. Also, too, if somebody does have low income subsidy and gets the extra help towards their prescriptions, and if they're at level 4, the actual premium for the Summit will actually go to $0 as well. So
wow.
that's something too that we can help out, and just to dissect a little bit further. But our copays for our PCP stayed the same, no cost with that. We increased our over-the-counter costs as well, and we also increased our flex card benefits. Our dental, vision all stayed the same. So a lot of it stayed the same, and we just really wanted to make sure of what was utilized. We either kept the same or we enhanced it, just so we were there for our members.
Based on the usage of
Correct.
the last 2 years.
Yes.
What about the prescription benefits on Vista? Has that changed at all?
This is the game changer, Mary.
Another one.
Yes. $0 RX deductible. That is something that is, we're keeping it. It's here. It's staying. And so we're just very excited about that. In addition to that, if they utilize a preferred pharmacy for our tier 1, it's $0. But also too, if they utilize their flex card, we added this, but they have to go to participating pharmacies with this.
Okay.
But if they utilize their flex card at the pharmacies that accept this, they could actually help to get the copays paid with their meds as well with this.
Wow.
Also mail order too. So if they get the mail order, the flex card can help them out with that as well.
Wow, that's a big deal. And $0 copays for preventive services and support. That's still with us?
Yes, that's something that's like mandated for us, right? So we just want to make sure that the preventative care is there. We want to make sure that, everything from the mammograms to the flu shots to all of those items that need to be covered, just to make sure that everybody is safe and healthy, those are covered at no cost as well.
That's a way for everybody to save money.
Yes.
With preventive care.
Correct. Yes.
Yeah. And the dental benefits on Vista. Just give me a little.
So staying the
Roundup.
same, $3,000 for both preventative and comprehensive dental. So that's all stayed the same. If they join the Summit, it's $3,500, so they get a little bit more. But again, it's the same benefit as last year and the year before. It's here and it's staying.
Excellent. And the vision benefits for Vista.
Same thing too. So it's $200 per year. In Pennsylvania, it's a little bit different, but here in this state, it's $200 per year. Same thing. So they get their glasses or contacts covered and their eye exams.
And what would be different in Pennsylvania?
Just the amounts.
Okay.
So they get $300 for the Vista and $350 for the Summit if they live in Pennsylvania or Greene County.
Okay. And hearing benefits.
So we added a new level. So we had a mid and a high level. So we actually added a low level. So now somebody can enjoy the hearing aid, where they can either join and get the copay at $3.99, $5.99, or $8.99. We always had it at $5.99 or $8.99, but we just added a lower scale, so it's $3.99. But they still get the same great benefit of the hearing aid. It's just a matter of we're just trying to work around all income guidelines of what we can. Yes.
Income levels.
Yes.
Great. And you've upped the flex card to $350.
Even higher. So
Even
it's actually
higher.
So now it's $365. So
yeah, remind us how that works and what it's used for.
So the flex card is used for anything outside of like the copays, right? So this is going to be if like the specialist copay, if they go to a dentist and they have the extra cost, vision, hearing, if they have inpatient hospital stay, anything that's going to cost them a amount, they can utilize this card, and their flex and their OTC is one card. It looks just like a debit card.
Okay.
And so it's just one card, one-stop shop. So the flex card and the OTC is the same exact card, but that's the flex card is utilized specifically for copays. But again, as I mentioned before, it's for the prescriptions as well at certain sites.
And that's an annual $350.
Correct. Yes.
Okay.
Yes.
Great. And for a small monthly premium, you can get the Summit PPO. So let's talk a little bit about the Summit PPO plan. What are the basic added benefits of the Summit plan? What do we get for that $16 a
Yeah, so
month?
it's just a little bit higher, lower copays for specialists, a little bit higher with the Flex card and the over-the-counter, higher for the dental part. Same with vision. Everything's the same with the fitness and everything else as well. So it's just a matter of really just looking at, the background of the member and just seeing, what is really important to them. And then our licensed agents can help them to understand if it's either the Vista or the Summit is best for them.
Okay. Now, I know this can get confusing sometimes,
Yeah.
but let's talk a little bit about the general benefits of the built-in Part D drug plan. First, tell us what that is and how that fits into all this.
So anybody that has the Medicare Part A and B can join on to this plan. The Part D is the prescription side of things, but I skipped over a letter. That's Part C, right? And C stands for like the combo package is what I say. So it combines everything into one.
Okay.
So they keep their Part A and B. So if they join on to Peak Advantage, that's the Part C. And then that's whenever they can get everything in one. So they're going to get their prescriptions covered, their dental, their vision, their hearing, OTC, transportation, fitness, flex. So it's that we're giving them that full one-stop shop combination package.
That sounds easy.
So it's just easy for them. They have the one card for their ID, and then they have their flex and OTC cards separately as well.
Wow. Okay. And you did mention the fitness program.
Yes.
Can you talk a little bit about these extras like transportation assistance?
Sure.
Like what type of transportation assistant and gym memberships too?
So we go through One Pass, which is our gym membership. And so they actually, we have over 100 locations. Even Peak Milan Aquatic Center is a part of that.
Oh,
so we're
wow.
really excited. Since the last time we spoke, we have some
Yeah,
branding
I
and some
forgot that
partnerships.
was added. Yeah.
So that's very busy up there as well. But we have over 100 sites that somebody can join and go through with that. But then in addition for the transportation, this is actually with the Vista, they get 24 round trips or 24 one-way trips or 12 round. And with the Summit, it's 36 one-way or 18 round. And what that is that it's curb to curb. And they can actually bring a caregiver with them too. So if they need help with getting to their doctor's appointments, but if they have like their son, their daughter or spouse,
Sure.
whoever, we can actually cover that again, curb to curb to and from their doctor's appointments.
But this has to be for doctor's appointments though.
Yeah, and also too, it can help out with some prescription picks up as
Okay,
well.
okay.
But of course, we can't take them to the mall or the movies or
No,
anything like
no,
that.
No.
But
Well, it's
yeah,
a health plan.
correct, right? So, but yeah, so this is a benefit that some health plans have actually taken out, but we've kept this as well.
I bet you get a lot of usage of
We
that.
do, yes.
Yeah.
It
Sounds-
helps out a lot, so I'm glad that we're keeping it.
Yeah. All right. So everyone's listening to this and they're really excited. So
Yes.
how do they enroll? How do you get more information?
Well, you can go to our website, peakhealth.org, or you can call into our phone number, which is 1-866-850-2603. But if you go to our website, you will actually see our benefits for our 2026, and you can see the split grids, and our phone number is listed on the top right there as well. And we can help you out over the phone, or if you would like an appointment in person, you can even come to the Peak Health office here in locally, or we have many agents that are licensed and certified that can help you with a one-on-one appointment at your home as
They're
well.
pretty much all local, aren't they?
Yes.
Mm,
Yeah,
you
we
know.
have almost 400 agents across the state that are licensed
Wow.
and certified and ready to help you.
You might be talking to your neighbor. Who knows,
That's
right?
right. That's right.
All right. So before we go, I always like to ask, what's the most important thing you want our viewers or listeners to know about Peak Advantage Medicare?
This is the important time right now. The AEP is to make sure that you have the benefit plan that is for you, because it's not everybody's health is the same. So if you do participate and go to WVU doctors look into this plan. This is something that this is your hometown plan created for you by your local doctors. We are owned by WVU Hospital System, Marshall, and Valley. And so we are just really happy to just say that we are here to locally take care of you. And this is your time before December 7th. Make sure you know of your options and just ask those extra questions. And if you just don't know what those answers are, please don't hesitate to reach out to us because we are here to help you.
And it's fastest growing in the state.
It is the fastest. Keeps
All right.
going.
It's got to be a reason for that,
Yes,
right?
Yes, correct.
Well, thank you, Missy,
Thank you, Mary.
for sharing all this information with us
Pleasure.
today. And I think, this will help clear up some questions people may be having as they're making their decisions.
Yes,
Thank
we're
you.
excited to help. Thank you.
Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on Peak Advantage, visit peakhealth.org/Medicare. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or on the West Virginia Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Missy Bazzo and everyone at WVU Medicine and Peak Health, thanks for joining us.